Hi everyone, in today's video we are doing a Kybella treatment. This patient has had a round of Kybella in the past, so this is her second round. She saw really great results from the first treatment, so now we are going in with the second. Oftentimes it does take a few sessions of treatment in order for the patient to reach their aesthetic goal that they're looking for. But in general, Kybella is an acid that destroys fat cells. So this is a really great treatment for that submental area where we tend to get that little pocket, of subcutaneous fat that's just really, really hard to get rid of, no matter like how hard you're working out. It's just an area where that fat likes to stay, unfortunately. So Kybella is a really great way to target that. And this is a permanent treatment because once we destroy those cells, they can no longer store and accumulate that fat. So this is a permanent treatment. It does take a few rounds, like I said. Most typically with patients, we see that it takes multiple rounds. But like I said, it is an acid, so this isn't the most comfortable treatment. So you can see her kind of wincing a little bit here and there. We did numb her topically with some lidocaine prior to, and of course we have our safe zone marked out as well. Always with any treatment that we're doing, we're always marking our safe zone, knowing our anatomy. And those little dots that you see there, it's just a little tattoo that comes along with the Kybella when you purchase. So you just put it on with a little bit of warm water, and it gives you the perfect spacing for your injection points. And I'm giving the tissue a little bit of a pinch as I'm injecting as well, and making sure I'm going right into that subcutaneous tissue and no deeper than that. Not every patient is a great candidate for this treatment, so it's really important to evaluate well and discuss with your patient what their goals are prior to going through with this. This is really to target that subcutaneous fat. So if a patient has looser tissue or maybe they lost a lot of weight recently, this isn't going to be necessarily the best treatment for them. If the tissue is loose, they'd be more a candidate for either like a PDO smooth thread to help tighten and build collagen, or even a PDO lifting thread. This acid is just for the subcutaneous pocket of tissue. So that is what we're treating right here. And as you can see, I am just popping right through and just into the subcutaneous. So I'm not even going, maybe about half needle depth here. Side effects from Kybella are rare, but they can happen. That is why we're being very careful and staying inside our safe zone of our markings. It is an acid, so it's going to destroy anything that it's coming in contact with. So you could have nerve damage or difficulty swallowing, things like that if you're not injecting into the area that you're supposed to be injecting into. I also go over kind of the risks and benefits, of course, and do very thorough education with my patients prior to doing any treatment, but especially when we're doing something like this. But overall, this is a very safe treatment, obviously. Otherwise, we wouldn't be doing it. And patients have seen some really, really great results. So after we go ahead and just finish up our injections, I clean them up really well. They can be sore and swollen, and the swelling can last for quite a few days. So again, that's something that I like to educate my patients on prior to doing the treatment, just so they're prepared as possible and they know what to expect. But we're just going ahead and cleaning her up, and we will see her back in a few weeks and assess if she'd like to do another round of treatment.